My name is Gina Hollenbeck, and I am a nurse who got lung cancer. I'm 44 years old. I have two sons and a husband who is incredibly supportive. I am an advocate for lung cancer, and I really hope that we can find ways to do early detection, screening, find new treatments, and hopefully do biomarker testing throughout tumor types. When I was diagnosed with lung cancer, I was working as a nurse, so I really wanted to be involved in my care, and I really wanted to understand what was going on. My doctor, who was incredibly smart, intelligent, in Memphis, he was based out of a community hospital, but he knew two things. He knew that lung cancer liked to go to my brain, so he ordered an MRI. And he knew that because I had absolutely no history of smoking, I had absolutely no family history of cancer, that there was a chance that I might have a biomarker and I might be eligible for some of the targeted therapies that were available back in 2015. So he asked me if I wanted to do this test. And he said, you might be eligible if you do this test that your insurance will likely not cover, but you might be eligible for a little pill that will melt away cancer versus doing IV chemotherapy and some of the traditional methods of surgery, chemotherapy, and radiation. And he said, so there's a chance that this little pill will melt away your cancer. My husband and I were like, yes, sign us up for that. So back in 2015, he knew to send away my tumor sample for biomarker testing. During that time, my doctor called me from Memphis and told me that I was ALK positive. And he said, this means you won the lung cancer lottery because there's a lot of drugs for ALK positive lung cancer. Like, just totally ecstatic because I think, oh my goodness, this means that I have more time with my children who at that time were in second grade and in sixth grade. And I was like, maybe I'm going to get to see them graduate from high school. Maybe I'm actually going to, get the opportunity to help them learn to drive and, do all the things that moms get to do. About 6 weeks after I started taking targeted therapy, I was NED, which is no evidence of disease. So it had melted in 6 weeks, melted all of the cancer away from my body. That's why it became incredibly important for me to become an advocate so that maybe we can get these standards in place so that everybody has access to biomarker testing and everybody has access to the targeted therapies that can treat them. If my doctor hadn't known about biomarker testing from the very beginning, that my cancer story would be a lot different. Any cancer can actually be tested. We can look at the DNA of any cancer. There were people who were entering into our support group who had cancer in different parts of the body. It wasn't all lung cancer anymore. We started seeing breast cancer driven by ALK, brain tumors driven by ALK, skin cancers, thyroid, sarcomas. All of these things were driven by ALK, and they were able to take some of the same drugs that the lung cancer patients were taking, and they were working. That was one of the things that was very interesting to me, and I thought, gosh, how do we find all of the ALK positive patients if breast cancer doctors aren't testing for ALK? And so my hope is that we can start looking at large genomic sequencing panels so we can really look at any cancer, look at the DNA of cancer to the best of our ability and try to figure out what's driving it so that we can always match the right patient to the right drug at the right time. That's how we're going to really figure out how to fight this disease and how to create survivors who live long and happy lives.